everybody. Suzanne with Dawning Visions Hypnosis. I have a question for a mental health therapist in particular. Are you finding yourself counting the seconds until your client session ends? Because if you are, maybe you're burnt out of this business. Or maybe you're not enjoying that particular patient any longer, if you ever did. We need to take accountability for when we're not invested in the work that we're doing with our clients and patients because they're paying good money to see us. They deserve to have us be present to help them. And we're finding that we don't want to be there any longer. That's a problem for you and for your patient. So what do you do about this? Well, my suggestion is to go to your boss if you're working in an agency and let them know that for whatever reason you're not really able to help this particular person. Do not blame it on the patient if it's your thing. It may be that you can just say that you don't have real good rapport, it's really hard for you to work with them, whatever. And then hopefully they'll assign that person to somebody else. If it's a person who's in your own private practice, it's best just to let them know that for whatever reason, it's just not working. And it's okay to be honest with them to the degree that you can be, and then give them a referral to somebody who can truly help them. They may not be happy with the situation, who would be? But at least they'll respect the fact that you had the guts to say the truth and to give them a name of a person who would be better able to help them. Try to make it a reasonable reason why you're doing the referral, like the person is more educated in their area that they need help with. Something like that would work out much better because then you're seen as a professional instead of just somebody who is, not interested in working with them for whatever reason. Because sometimes, the rapport's not there. Sometimes the person's outside our scope of care. Sometimes they're outside our scope of interest. And you can't really pretend that it's not. At some point, your patient's going to feel the fact that you're not present for them because you're not going to be able to interact with them in a way that makes sense because your brain was elsewhere, not on the conversation they thought they were having with you. So best to nip it in the bud and take care of it. I know that over the years, I've had certain clients that the rapport really wasn't there. They weren't really ready to do the work. They didn't want to do the work. And as a hypnotist and neuro-linguistic programmer, I'm interested in working with people who want to be healed now, not people who want to complain endlessly about their problems. They have to be willing to do the work. I can facilitate it, but they have to do what they have to do to be well. It's not a magic wand. Unfortunately, some people believe that hypnotism is a magic wand. But I promise you that when people are dealing with a lot of trauma, when people are dealing with a lot of negative people coming into their lives, doing damage to them, or maybe they did damage to other people, who knows, different situations for different folks. They have to be willing to do the work. And if they're not willing to do the work, there's not anything I can do for them. And I tell them, actually, I try to do this before they're ever hired on. If they're a good match or if they're not a good match. If they're not a good match, I refer them to somebody else. Or I at least let them know that as far as I'm concerned, it probably will not work for them. So we have to have a good idea of the type of people that we want to work with. We have to have a good idea of how we work with various people so that we can screen out those who are not a good match for us. It's not fair to them either, quite frankly. They need to work with people who are able to give them what it is that they need and want. And because I do hold my clients accountable to do what they need to do to be well, I'm not for everybody. Seriously, I'm not, and I let them know that. Because there's no point in getting into a relationship with a client when it's not going to work. Even though I do my best to screen out people who are not ready to do the work, sometimes one of them will get by anyway. It's life. So that's my input for you for this particular situation. If you're interested in learning how to do hypnotism and neuro-linguistic programming, I do offer a 2-day VIP program with a 12-month mentorship. A mentorship program that I don't know of any hypnosis company or NLP company that offers it. Not now. It was offered way back in 2003 and 2004 when I was doing my NLP practitioner and my NLP master practitioner program, for which I'll be forever grateful because that's how I got really good at what I do. Calling my trainer's office and getting really good input on how to best handle my clients so I didn't cause any unnecessary problems along the way because I didn't know how to deal with it. So I offer that up, and I would really love to train as many mental health therapists in how to use hypnotism and neuro-linguistic programming so you too can truly help the majority of your patients heal. Because the only people we really can help heal with hypnosis and neuro-linguistic programming are those who had licensed professionals diagnose someone with personality disorders, people with an IQ of 70, and people with psychotic breaks in their history. Other than that, you can pretty much help anybody else. I know because I've been doing this for 20 plus years and I've helped many different kinds of clients who are not helped elsewhere. So if you're interested in learning how to do this, I'll leave my contact information in the description box below, and we can set up a time for a video call to see if that's something you'd like to pursue. As always, I thank you for spending your time with me. Till next time. Bye-bye, all.